on and on. But between then and now, we've had the opportunity to really build some public health infrastructure. And so what I believe will happen through the start of school is that we'll continue to be fairly steady. We might have a little bit of a decrease, but what I really think is we'll have outbreaks that pop up here and there. Already over the weekend, I was notified of 2 more outbreaks that we're helping investigate. And so as these things happen in the state, we'll continue to I believe we'll have the public health infrastructure to stay on top of that. Once school starts up in the fall, that will be something new, right? That will bring a lot of kids together. And I don't know that it will immediately be a game changer. I expect that, again, there'll probably be a few schools that experience an outbreak, but I don't expect to see widespread or mass overwhelming the system. I do think that there will be another increase or surge once the weather starts to cool down and people really start to come indoors. Another thing that I think will contribute to that is just as time goes on, people's risk tolerance is just going to change. Even over the summer, people's risk tolerance is going to change. But going into the fall, parents, students, teachers, everybody, they may just feel like they may change their behavior. So with a combination of those factors, that makes it really hard to know scientifically what's going to happen. But that's my best guess, is that we might start seeing some real challenges come November, December.
With regard to that, Dr. Wendelboe, the one thing we've talked about previously is with regard to contact tracing. I was wondering if you could talk a little about that, and really in terms of the fall, what role, if any, school districts would have in terms of contact tracing if in the event of a positive case or a suspected case.
Great. We would appreciate knowing about cases and exposures as soon as possible. So you can call your county health departments, or you can also call the state health department. Our number is 405-271-4060. Again, that's 405-271-4060. But the best bet is really just to call your county health department. But we will be happy to still take the lead on those investigations. Having said that, the extent to which we're able to partner with each of you, it will be helpful. And just so that you all know what to expect, that would look like is that it starts off with, typically we would want to start off with a confirmed case, and then we want to know who that confirmed case was around. And it's not just casual contacts, but people that they were within 6 feet for 15, 30 minutes longer. We would start off with those. And obviously we anticipate that there will be a lot of questions. People will be coming home, and questions will be like, my child went to an orthodontist and they were in the waiting room with somebody who turned out to be positive or whatnot. So again, we're happy to just work with you as we get those questions. But as far as what that ends up being for you all, whether that results in a closure of a classroom or a school, I don't have any specific guidance right now. I think we'll take it as it comes, but I just want you to know it's not my default to just say, well, once you have a case in a school, that you're going to have to shut everything down. I think each circumstance is going to have to be investigated.
Hi, Dr. Wendelboe, this is Carolyn Thompson. I just wondered if you might be able to address screenings. Should schools do any sort of screening for individuals, staff, teachers, students that would be entering their buildings in the fall. What is your recommendation as far as how schools can play a role in making sure that we know who may be exhibiting symptoms?
Yeah, it's a difficult question to give a solid answer to. The diagnostic test or the PCR test, the swabbing that we're talking about, it gives us a very clear answer, but at the same time, it's only for a point in time. And so we, as a general approach in the state, we're trying to get as much availability of testing as possible. So I don't want to discourage screening, because the more testing we do, the more we know where the virus is and isn't. At the same time, I don't want you to feel like you have to do that screening. It may not be feasible in your district, or if all the schools are trying to screen at the same time, it just may not be logistically possible either. So while I'm trying to say it's helpful, but it's not critically important, especially because let's say that we find a lot of negatives that first week of school before they come back. In a week or two, we're in a way you're starting back at zero again, because people could have been exposed. And so the use of that information is essentially, as people come in, we identify any positives, and that would be helpful because we could keep them out of the school. But just thinking about the logistics of a long-term plan, I'm not sure that we would be able to keep screening on a routine basis every week or every 2 weeks.
So then on that note, would it be more appropriate perhaps for schools to do something like a questionnaire like many businesses are doing, where they ask a series of questions before individuals enter the school, or do temperature checks, something along those lines? Would that be appropriate?
It is appropriate. That the more you can do, the better. It's also related to a lot of questions I get is it safe to do X? And these are difficult things to answer. Anything beyond total shutdown or sheltering in place is going to elevate your risk a little bit. And so if you're able to screen, I think that's great. If you're able to do the questionnaires, I think that's great. Temperature checks, again, I like all of that. I just am not sure if where we're at as of right now to say this is a formal recommendation that we think every school has to have in place.
So let's talk for just a moment about transporting students. Everyone on this call is going to deal with that. And you may have some recommendations that you'd like to share now that I know will be also reflected later in our guidance that we're going to put out this week. But would you like to try to address that now, as I think we've got lots of open ears and interest right now on the call?
Sure. I appreciate that transporting our students is going to be a challenge. By the very nature of buses, it brings students close together. And so I can try to comment on things that would decrease the risk, where let's just say that the most risky situation is what we've always done, right? No masks, bring students in, try to put as many students on the bus as possible just to maximize resources and everything like that, right? And so ways that I would like you to at least consider of reducing that risk is that using masks for each student. That will be helpful. I think it's by and large something that's doable. Another thing that's helpful just to think about is airflow. Consider keeping windows open on the bus to the extent that that's possible, just because disease transmission for COVID and other respiratory infections is just harder when there's a lot of airflow. So that will be helpful. And then to the extent that districts have resources to space students out, have more bus routes, whatnot, I'd ask you to consider it. Again, I recognize we do not have unlimited resources, and you'll just be doing the best you can with what you have.
Thank you. We also, just along the lines of the temperature checks, what is the temperature that would be a temperature reading that children, students, or even staff should be turned back around to go home?
I would say 100 degrees Fahrenheit. Just, it's better to be safe than sorry. And to the extent that we're just able to keep people that are sick at home right now and keep the schools open, I think that would be wise.
Doctor, with regard to social distancing in general, can you talk a bit about the importance of 6 feet and really putting that in terms of if you would consider that a quote unquote best practice going forward when schools reconvene?
Yes, we have all heard a lot about the disease transmission and ways to reduce our risk. And as we've learned quite a bit of information through this pandemic, the person-to-person spread through that close contact is does account for the majority of the spread. And so while certainly there is still a lot of emphasis on cleaning surfaces in the environment, which I don't mean to say isn't important, but as you all are thinking about what can I do that's going to have the biggest impact, it's the social distancing that's going to have the biggest impact. So the conventional wisdom is when people sing or cough or speak, that those droplets spread approximately 3 feet. And so the guidance of 6 feet was to double that 3 feet, giving us some wiggle room, especially because COVID was an unknown virus. CDC and all of us continue to maintain that 6 feet should be adequate space to keep people separated so that you're not getting people close enough to transfer those droplets to each other.
Okay. Dr. Wendelboe, to expand on that, classes that districts would normally have, like choir or PE or band, things of that nature, where there might be the possibility that students would, that those droplets might travel further just by the nature of the activity. Could you speak to recommendations on how schools might handle those sorts of activities during the day?
Oh, that's a tough question, and one I've thought about, but I'm sorry, I don't have a real recommendation for you yet at this time. I'm not afraid to say that I have a high school student who's in band. So again, I guess I fall back to the position that engaging in these activities does increase the risk as opposed to not having them. I realize that a lot of those extracurricular activities is really what makes school enjoyable for these students. It's an important outlet for them. At the same time, if there's a question as to what you can do to minimize your risk, I would say that these type of activities could be postponed or spread out or conducted in a way very non-traditional, to the extent that they can be done. I know a lot of music teachers are using Zoom or whatnot. I would just encourage you all to really try and be as innovative as possible when thinking about potential solutions there, just because you're right. For those of you that aren't aware, this hit the national news, so I think many of you will be familiar, but in Washington State, early on in the pandemic, one of the largest outbreaks was in a church with choir with a lot of people singing. So that singing was an important source of exposure, in which many members of that choir even ended up dying from that outbreak. And so, I just want people to be aware that these really are impactful decisions about whether or not you want to keep those activities going.
With regard to social distancing and all of this, certainly the whole matter of masks and face coverings have been at the forefront of, certainly, I mean, we've seen some contention on people who refuse to wear masks or people who want to wear masks. Can you talk a bit about the importance, if it is important, with regard to social distancing and just going forward into the fall?
Sure. My personal approach is that wearing masks is as important as requiring people to wear pants and underwear. It's just, it's not a violation of people's human rights. It's just we are part of a society, and we have rules that we think are important. And at this point, wearing masks is something that has been shown to help decrease the transmission of the virus. And again, I'm not shy to admit when I've learned something. Early February, I was saying things like, there's not a lot of evidence about the use of masks. And so at that time, we weren't recommending it. And now, me, along with people at CDC, a lot of people are now saying we have the evidence that those masks work. And so rather than being embarrassed about it, I just feel like it's my responsibility to say we learned from the situation, we gathered information, and we changed our recommendations. And so now we've just really seen that those masks are an effective way, especially when used properly, to cut down on the transmission. Now, having said that, I recognize that if you are a teacher and you need to teach, however long the school day is, 6 hours, 8 hours, it may really cut down on the teacher wearing a mask. So thinking about whether a face shield works, or again, just the social distancing, I think that if a teacher can be far enough away from their students, they could probably still teach without the mask, as long as they keep that distance away. And so just because I think that the masks are critically important, I'm not saying that you have to have everyone masked every second of the day. And again, like, the way you would handle a kindergarten class is going to be different from high school. So I don't know that we have time to get into all those differences right now. But again, just thinking about the transmission, there are going to be parts of the day where students just are not going to maintain that 6 feet distance. And so during those activities, really please emphasize the use of masks. During activities where you can maintain the social distance and it really improves the educational experience, then I think it might be reasonable to let the students take off their mask for those periods of time. So I'm not trying to say there's a one-size-fits-all approach, but just really think about the importance of this to society, and that while people feel like they may have the right to wear or not wear a mask, everyone has the right to be protected. And so I think that that's just as important, if not more important, than this idea of government telling me I should or shouldn't wear a mask.
And let me ask 2 quick follow-ups to that. So one, I wonder if there is, with some people, a misperception that the masks are more about protecting the one wearing the mask, or about people who are around that individual who's wearing the mask. Can you address if masks do primarily offer protection for the individual or for those around that individual?
The primary help is if somebody is sick, it will, by the person who's sick wearing the mask, it keeps that infectious person from spreading the virus to others. And so, so you wearing the mask is more about protecting others than yourself. And that doesn't mean that wearing a mask doesn't protect yourself anyway, but that's why it's got to be a team approach, is because, and especially in schools, there's a lot of younger people who tend to be more asymptomatic. And so just going around day to day, none of us really know if we have that virus and if we're transmitting it to others. I'll circle back to then the case and contact investigations is to the extent possible when we test and we learn who has and who doesn't have the virus, I think that we can intervene so that we don't have to shut down the economy again. But at the same time, just making those reasonable changes to our habits, I think will really help us keep the system open.
And with regard to masks, are there specific, is it a cloth mask you would recommend, a surgical mask? I'm assuming that N95 masks are not advised since we want to keep those for healthcare.
Yeah, and N95s are even more difficult to teach in for a number of reasons. And I don't think that would be necessary given that the healthcare workers we like to have in the N95s because they're in a known exposure situation, right? People with COVID are going to the hospital to get treated, and that's not the same level of risk at our schools. So surgical masks are okay. I think that the cloth masks are a great idea, especially that there's a little caveat there only because not every cloth mask is the same, but to the extent that a cloth mask can cover both the mouth and the nose and fit tightly and is comfortable, those are great because students, teachers, they can have maybe a couple of them and they can rewash them if something falls on the ground. You know, it's not just you're out of mask. If you have a backup, you can just wash it and use it later. There may be a shortage of surgical masks. To my knowledge, there's not a shortage today, but again, this is a global pandemic. And we saw early on in the pandemic that when China was hit first, that was 1 billion people, and 1 billion people started wearing masks. And so there was a worldwide shortage of masks. And honestly, that went into some of the recommendation because it's hard to recommend the use of masks when you don't even have them available, right? It only incites panic. And so, so by people preparing now to get the cloth masks available, then we don't have to worry about a shortage of surgical masks in the future.
Dr. Wendelboe, there's a question about, this entire conversation around social distancing, masks, other temperature taking, et cetera. At what point, not a date certain, but condition certain, would you say and point to when we wouldn't need to be doing these things? Like, we wear these, we do this until, and what is that point we're all hoping to reach?
Well, so I think it's going to be a while from my perspective. From the epidemiologic point of view, it's really when we've reached herd immunity, and that's either because of natural exposure or because we have an effective vaccine, and we then, I would say that 70 to 80% of people have antibodies and are protective against infection again. I'm pretty sure that we in Oklahoma are currently below 2% prevalence right now. So to get up to 70 or 80%, that's, in my estimation, that's going to take a while. So I do think that we're in this for the long haul. Having said that, there's other perspectives to the whole situation. I guess what I'm trying to say is early on in this response, we talked about flattening the curve, and I believe Oklahomans were successful in flattening the curve. And so I think that we're all in this together. It's a learning experience, but I just see this as something that through the next school year, these are if we want to reduce the risk as much as possible, these are the behaviors that we want to be engaged in at least until next summer.
Dr. Wendelboe, we've talked a little bit about screening and testing, but in the event that an individual in a school either exhibits symptoms, has a temperature over 100 degrees, or in fact tests positive, how long does that type of individual need to be out of the school setting before being allowed to return? What are those return protocols?
Well, what we'd like to do then is if people have those symptoms, if we can get them tested as soon as possible, and again, testing should be made freely available through the county health departments and probably through other avenues as well. So within a couple days, we should know whether or not that person is infected with COVID. If they're not infected with COVID, then you can go back to probably your original school policies about when you would recommend students to come back to school. If they're infected with COVID, then the recommendations is that they be out probably for 10 days. And well, a lot of it has to do with symptoms. But if they have 3 days without fever and not using a fever reducing medication as well as a progression in other symptoms, then we can look at having them come back to school.
And as a follow-up on that, there was a comment that perhaps now it's still maybe taking 7 to 10 days to get a test back. Do you know at what point that might be a quicker turnaround?
Well, we should be down to 3 days to getting test results back. We can touch base offline, but if you or anybody is having experience with a 7 to 10 day turnaround, please let me know, because our overall testing strategy is to really reduce that. So we really should have the capacity to be down to closer to a 3 day turnaround right now throughout the state.
We've had a number of questions about cleaning of equipment, whether it be disinfecting computers after every use, questions about sanitizing buses and steps to take. Can you talk a bit about, if you were to say what equipment or spaces it might be more important than others with regard to disinfecting? And you had mentioned earlier that it's primarily individual to individual contact that spreads. Taking that in context, what would you suggest or offer with regard to just cleaning?
No, I would just say that high touch surfaces are going to be a priority, and the more cleaning you can do, the better. And if that's shared computers. So to the extent that you are able to provide students with their own things that they don't need to share, then that reduces the opportunity for miscleaning or for mistakes to happen. Having said that, obviously there's a limit to that. And so then again, I would just say, try to use the resources you have to do the cleaning in between student use. But the higher the frequency that it's changing hands or being touched, the more important it's going to be to try and clean those surfaces, just because it's a lot of this you can think about like playing the lottery, right? You buy a ticket and just one touch or one exposure has a pretty low risk of actually leading to a transmission of disease. But the more tickets you buy to the lottery, or the more time somebody is touching something, that's just increasing the risk with each touch.
May I just ask this? I saw, back to your comment about the high touch areas. If we know a computer lab is going to be used by lots of students, would this be an idea? First, cleaning is great, but before students go in, they wash their hands or have hand sanitizer before they touch anything. to at least think about layering where we know these are high touch areas and maybe adding that hand sanitizer passing through into the room. It just at least layers, and that's a practical thing that we have that could help minimize the risk in that. I don't know if that's an example of layering safeguards.
Absolutely, that's a great recommendation. I appreciate you bringing that up, Superintendent Hoffmeister. I like that.
And then maybe even on the way out, because if you got something on your hands that you picked up, before and after, I mean, I think about it the way that's how I do when I go into the grocery store. You know, I wash my, get the hand sanitizer, and then before I get back in my car and touch everything again, I use a hand sanitizer as well. So, I mean, just thinking about the before and after of high touch or higher risk activities. And if we think about that, I'm seeing lots of things in the chat about, but what about kids wearing masks in helmets, or kids that have breathing problems in masks in sports? I mean, I know that there's lots of scenarios there. Kind of speak generally to sports, if you will.
Yeah. So again, there's, I like the way you use the word layers, because the first layer is that social distancing, and I would say equal to it would be the venue, whether it's inside or outside. So sports like tennis and baseball probably are lower risk than wrestling. And so just because of that, the nature of the sport and the social distancing. And so there is certainly going to be an increased risk if, if you're going to have your kids engaged in an activity where, it uses a lot of physical exertion, it's not going to be practical to have people in masks. That restricts that breathing, because you're almost certainly going to have a hypoxic incident rather than a transmission of a virus. So I don't recommend using masks in those sports situations. So that's where I think you need to go back and just decide, are you going to still hold that sport for this school year? But for those sports or activities where you're trying to make a judgment call, I just think that you might, like going back to baseball, I would say that in the bullpen is probably an opportunity where the student athletes could be closest together, just thinking about how to social distance them in those areas. I think that there are ways to have some of these activities proceed safely. But football or volleyball, I just don't see a way really that you can use masks or social distancing in a way to prevent disease transmission. If you engage in those activities, I think it's just going to carry a higher risk.
Dr. Wendelboe, could you speak to the effectiveness of the current antibody test and kind of what sort of timeline we're on to have those bolstered such that they are closer to 100% effective, if there is such a thing?
Well, I don't know that the quality of the antibody test is going to improve soon enough, but there's another factor that's the prevalence of the disease. And so we are rolling out, currently there's antibody testing being done, but we are also within the next couple weeks, we should be doing more widespread antibody testing. And actually this brings up an important point that I like to get your feedback on, and of course it doesn't have to be right now, but there's two different types of antibody tests. One is using a finger prick, and the other is using venipuncture, using a needle and drawing blood from somebody. We're looking at the former, using the finger prick, and we would like to do some testing among children. But whenever we do surveillance, particularly using a specimen that involves blood, I think that we really want to think about the safety of our minors. And so to the extent that you all in education feel like you may want to partner with us in designing a way of getting people screened, that will actually be helpful to us, because obviously we want to design a protocol that we have everybody's buy-in and they feel like it's helping them, it's helping their community. But yes, our plan is to do repeated antibody testing probably every 8 weeks, so that we can just share with the public how that change in antibody titers are. And so even though right now at an individual level, you may get a false positive, but as far as a population health approach, if we're able to do this testing, the change in that proportion positive will actually be meaningful, even with the inherent inaccuracies of the test. So just to provide an example, if we were at 2% population prevalence right now, and then in 8 weeks, we saw 4% or 6% population prevalence, even if we aren't as sure whether that 6% is exactly right, but the change from the previous baseline will be fairly accurate. And I think the more we do that through the summer and into the school year, I think a lot of us are going to have a sense of how that's changing here within Oklahoma.
So I saw a question about, should we require all students be tested for the virus? But it sounds like if there was going to be some kind of, not requirement, because I don't know if that's really something we could do, but it would be preferable for the antibodies of the virus detecting the exposure to the virus.
Yeah, it would be helpful if we could do antibody testing among our students. It would really help us as a community know, but also let me just add that we would want to do this repeatedly. Like I said, I would say about every 8 weeks, so that's every 2 months. And not everybody has to be tested every time, but if we got a fairly sizable sample, like 100 students within a couple grades or whatnot, I think that would be helpful, across our different counties.
Very good. Okay, that's helpful. And there may be parents who are more than willing to find that information out and participate. Phil.
We've had a number of questions going back to the whole process. If there is a positive case or a case of someone who has had exposure to someone known to have COVID. And again, you addressed some of this, but just wanting to nail it down further because there were some follow-up questions. If there is a if there is a positive case, it does not or doesn't necessarily mean that the school needs to shut down for any period of time. And also with regard to the 14-day quarantine, let's say I have been exposed to someone who has had a positive case. If I wait the 14 days, am I without symptoms, would it be okay for me to go back to the school even if I have not had a test on COVID at that point?
Yes. Once people have passed their quarantine period, they can go back without testing. Again, I'll just reemphasize that we hope that people will get tested, particularly the diagnostic testing. It doesn't draw blood. I've been tested. It's not comfortable, but it's certainly not painful. And so we would hope that people would be willing to be tested. But no, and the quarantine period, I just saw a question go up, is 14 days. The 10 days that you probably heard me earlier talk about was for symptomatic people. And so, sorry, I'll get a little bit nerdy on you all, but you have probably heard the term isolation and quarantine. And those two terms actually do have different meanings here. And so quarantine refers to people who have been exposed but not infected. And so we wait that period of 14 days because that's a period in which they may become symptomatic. Whereas once somebody's infected, we wait out the isolation period because it's a different time frame because it's how long they're shedding the virus. And so, sorry, sometimes this can be confusing, but that's why those time frames can be different.
I know in some of our recent conversations with you, you talked about the importance of air ventilation and the HVAC systems. Could you just mention a little bit there in just a moment's time about the importance of how those settings are set for schools?
Sure. Traditionally, I am all in favor of the energy settings, but right now, the more that we can displace that air, the better. So I would recommend that for those well-functioning HVAC systems to essentially put it on the maximum air exchanges. That's going to really help with that airflow and reduce the risk of transmission in your schools.
Okay, thank you.
Dr. Wendelboe, could you please speak to school closure in the event that there is a confirmed case? Do you anticipate that that will be a part of the response if there is an isolated case, or at what point do we get to needing to close a portion or all of a school?
My apologies. I may punt a little bit on this question and not give you as firm a recommendation, but my feel right now is that a single case doesn't necessarily warrant closing the school. If we are able to proceed as my plan, which is public health is able to do its job by doing its case and contact investigations, then that means we should be successful in identifying people who had that close contact or that highest risk of exposure. And if we can isolate and quarantine those people, then I believe that in many situations we'll be able to keep the school open. And again, thinking of phases or layers, if we felt that that was a classroom or even a pod, maybe we would need to close that down. But I believe that we wouldn't just start by saying, oh, we're going to shut down the whole class or the whole school. I think that that may be a bit too much at this point. Like I said, I realize that there's some changing guidance here, but we really are in a different situation from early March where we just didn't have the ability to do these investigations. And that's why we used the blunt approach of having everybody social distance the way we did.
Can you speak to class size? Certainly the recommendation with gatherings of no more than 10 is rendered pretty moot, obviously, with school. Do you have any thoughts on what is, like, just numerically, what would be a safer number in terms of social distancing?
There's colleges and universities are talking about class sizes of 40, so they're limiting any class sizes over the size of 40. I'll be honest, I haven't seen the literature or the evidence to support that number, but at least I share that with you as from what some other people are using. But again, just it's hard for me to know what resources you all have in being able to make choices, but the smaller class sizes, spreading people out, and if there's COVID money available through the districts or through the cities to provide portables or, just giving you guys more flexibility in what you're able to do, I would certainly encourage having smaller class sizes just because that's going to spread people out and reduce the risk.
All right. I know there are going to be plenty of questions that we weren't able to cover in specificity. And I'm just glancing through all of that. I know there are times when people want to have a real clear yes or no. And just like you mentioned, it depends. The answer comes based on the conditions of what we know through contact tracing, what we know about exposure, on whether or not a whole school has to be shut down. Or if, I think you had mentioned on an earlier call that if you have 2 cases of COVID, and that doesn't mean that at 2 you close down the school. It might mean that if everyone's clustered and there's a difference between, or maybe it means it's different when they're in separate places and they are completely unrelated. So can you just speak briefly to how it is difficult to give just a cut and dry answer that's real, a prescriptive recipe, and why it may be important to simply contact the health department for guidance on that situation?
Sure. Even with previous diseases, whether it's measles or pertussis or pink eye, influenza, I don't know that we have a lot of guidance that we would shut down a school because there was a case of TB or measles. We would, again, that's what the health department and what epidemiologists do, is they go in and they investigate and they identify who's been exposed and the extent of the situation. And that's even more true here for COVID, because with a lot of those other diseases, there's a lot of papers published and a lot of experience in a lot of different situations. So we have a better idea of being able to predict what the impact of our actions are going to be. With COVID, even though we've learned a lot, we're still going to continue to learn a lot. I don't know that we've really seen what it looks like to have schools open in the time of COVID. And so our goal is to work with each of you, recognizing that there's just so many needs, that your parents have needs. They may be working, and there's childcare needs, and there's educational needs, and there's so we want to just be partners with you so that we listen to your individual circumstance, we take in the information, and then we try to respond in a way that benefits everybody while recognizing everybody's different competing needs, and but at the same time preventing transmission of disease.
Okay, very good. I did see someone say, can there be too much hand washing or too much use of the hand sanitizers with the immune system?
No, not with the immune system. Our healthcare providers, they have 5 or 6 opportunities to wash their hands per patient. And so if they're seeing 4 patients an hour, that's like, that's a lot of hand washing. And the risk comes in just, it can dry out the skin or whatnot. And so we recognize that. We don't want our students' hands to get chapped or whatnot, but it doesn't do long-lasting damage or anything like that. We would just encourage people to use hand hygiene and then use lotions, and then take care as much as you can.
All right. Well, and as we close up, we have just a minute left. Could you close us up with just thoughts as these district leaders on the call? We've had over 500 here today. As they are thinking about plans for reopening school, top of mind, those things that they should be considering as they prepare.
Sure. And again, thank you for having me. And it's humbling to be with you and try to imagine all the difficult choices you have to make. And this time really requires a lot of flexible thinking. And I think just maybe going back to the masks, right? We learned something and we changed our recommendations. And I wouldn't be surprised if many of you were put in that situation where parents might be frustrated that in the past you said one thing and now you're saying something different. And I think it just requires all of us to keep that humility that we're going to try and learn, that we might make mistakes, but we're going to apply what we know. And right now, the things that we know, the best thing we can do is to implement social distancing, to use masks, to sanitize our environment, and that as we think about the needs of the population that we're serving, I think that that will guide us to respond to our individual circumstances, even though I feel the burden that you have as I say that.
Thank you so very much. And it's great to have you on. I appreciate the aspect of science that's part of continuous learning and learning from evidence and data. And that is something that is evolving with a novel virus. So we are with you in that as that's part of what we do with kids every day. And I know you are a parent of kids in Oklahoma Public Schools, so this is just as real for your family in a practical way, personally, as it is for everybody on this call that are in the trenches in schoolhouses across the state. So thank you so much for your expertise and time. You made it very easy to understand, and we'd love to have you back at some point because we know that there'll be new questions as we continue to prepare and get ready or get into the fall and have a different set of questions with even more data and evidence.
Absolutely, I'd be happy to join you as much as you'll have me, and to whatever help I can be. But you're right, I appreciate all the work that you do collectively. It's a lot, and so thank you for being partners with us.
All right, thank you. And thank you to everyone who joined us today. We will be back soon, but thank you for being our guest, Dr. Wendelboe, and take care. And to everyone on the call, thank you. Take care.
You too. Bye.